Thanks for staying with us right here on Sunrise. As we continue this morning now on our health slot, we talk about emphysema, which is a disease you get when the linings of the tiny air sacs in your lungs, they become damaged beyond repair. Now, over time, your lung damage gets worse. And of course, research shows that smokers are about 6 times more likely to develop emphysema than non-smokers. Dr. Alan Peter from the South African Thoracic Society joins us this morning to talk more on emphysema. Doctor, thanks very much for joining us.
Thank you, Penny, and welcome to your listeners.
Okay, so just briefly, I was asking you off air, so what is the Thoracic Society?
Yeah, so the South African Thoracic Society comprises of all the lung specialists, that's adult and pediatric lung specialists in South Africa, and the cardiothoracic surgeons that are involved in surgery involving the lungs. And we have a meeting once a year and smaller meetings during the year.
So how prevalent are lungs diseases in South Africa?
Well, due to smoking and also HIV and TB, it's on the increase. And by 2020, 2030, lung diseases, and particularly COPD, of which emphysema is a part, will be the 3rd leading cause of death worldwide. So it is a massive problem. And it is certainly underdiagnosed because you develop COPD, and the effects of smoking are gradual, slowing over time. It's like cooking a fish in slightly warm water, and before you know it, it may well be too late.
Okay, so I mean, I'm sure there's research and all sorts of things that you guys are involved in that can help us make sure that we educate our country and we cap those numbers.
Well, we should be doing that, and we should be doing a lot more, certainly in the media and with shows like this.
Okay, so let's talk about emphysema and secondhand smoking. But before we get to that, what exactly is emphysema?
Okay, to understand emphysema nicely, I want you to think of a sponge, a large sponge, and the lungs are like spongy tissue. As we breathe in, the sponge brings in water or brings in air, and then when we breathe out and you squeeze the sponge, you squeeze out the water and the lungs will push out the air. Now, there are 2 parts in the lung structure. There are the pipes going into the lungs, which we call bronchi, your major and small bronchi, and then you have the tissue, the spongy tissue, where all the gas exchange takes place. Now, what happens with smoking is that holes are created in the lung tissue as a result of damage caused by the body trying to get rid of the noxious particles that we inhale. And if you create large holes in the spongy tissue, what then happens is you can't bring in enough air to use. And so emphysema is the destruction of lung tissue.
Okay, so obviously we've been having those interesting visuals there on screen, trying to get our audience to get to understand what is it that you were mentioning and talking about, all of that from those diagrams, as you can see there. Okay, so obviously sometimes it's very confusing to know, like, you know, when it comes to like breathing problems, the difference between things caused by emphysema versus something like asthma. How do we differentiate?
Okay, so usually with asthma, it usually starts at a younger age, and you might find that there are triggers, and it's a much more quicker onset, where you get shortness of breath, wheezing, and eventually it gets better on its own and you come back to a normal status. Whereas emphysema usually occurs at a much older age, and what happens then is you usually have a habit that's associated with an occupational exposure, whereas asthma, there's no single permanent one exposure that leads to chronic disease. So, and it's usually smoking. 80% of all patients with chronic lung diseases, which we call COPD, which stands for chronic obstructive pulmonary disease, of which emphysema is a part, is caused by smoking. And so that's broadly the difference. However, an asthmatic patient who smokes later in life can also get emphysema, and then it becomes a little more tricky. So it's the previous history of asthma, quick onset of symptoms, identified with the particular trigger, whether it's cats, pollen, winter, summer, and the patients know that it sets their chest off very quick. So cannabis, yes, can cause emphysema, and it's usually the regular heavy cannabis users. The occasional joint is not going to cause emphysema, same as the occasional cigarette does. But cannabis, yes, can affect the lungs. What is the mechanism that the lungs protect us against these illnesses is in the airways, each single cell has got hundreds of little, we call like little brooms, we call them cilia, and they try to move the noxious particles and air pollutants and things that get trapped up into the nose. Now, smoking damages that pathway, and it's like having a pavement or an escalator where you've got missing steps in an escalator, and you can't get the stuff up from your lungs, and that's what results in heavy coughing in the morning. And that's one of the symptoms of COPD with chronic bronchitis and emphysema, is the coughing in the morning, trying to clear the mucus that gets trapped.
What is the impact that it can have on what impact rather can nutrition have and diet on emphysema? Is there a way that you can?
Yes, so emphysema can cause deconditioning of your muscles because you're not exercising so well anymore. Emphysema and the effects of smoking can affect your bones. Your bones become a bit brittle. So you need a healthy diet, but people often lose weight because they get breathless eating. So you need a healthy diet, you need regular exercise.
What is breathless eating?
Breathless when eating.
Oh, they get breathless when eating. Okay.
So what happens is you find people with severe emphysema, they take twice as long to get up in the morning, to dress, to wash, and they don't go out. So there's also depression associated with COPD. You also, if you have chronic bronchitis and you're coughing, you can't go to movies because you're coughing, you can't sit in restaurants because you're coughing. So nutrition is important, but the single most important aspect is to stop smoking. And I don't know why our government still sells cigarettes. Perhaps for it's a tax benefit, but it is criminal to peddle cigarettes in today's society with what we know about science.